Okay, this is Dr. Scott Geller, laser floater expert in Fort Myers, Florida. It's the end of April, and we have a great patient from New Hampshire here who spends the winter down here. But so you had cataract surgery. You had what was called a crystal lens, which is not my favorite lens. It's supposed to give you some accommodation so you can see distance and near put in. How many years ago was that?
About 12 years
When
ago.
did that floater issue start to develop?
About a year after the cataracts.
Yeah, and that's not unusual. You had a posterior vitreous separation, and you had like a bunch of fibers, like spider webs, more or less, going across your field of
Correct.
vision. We have gotten rid of the density of it, obviously, but you still have some stuff there. But overall, is it a positive direction?
I think it was a great procedure, and
Yeah.
I think Dr. Geller has done a fabulous job.
Oh, thank you,
Great
thank you.
man, great doctor.
Yeah.
And it's a pretty interesting procedure too, I
Yeah,
must say.
yeah.
It's,
Well, I'd like to tell other ophthalmologists. I think a lot of guys get into this, and they think it's just like pushing a button, and you do it one time, and that's the end. Like what's called a capsulotomy,
Right.
which you had, but it's not that at all. It's a whole nother ball game. It's a little like plastic surgery. You got to get a feel for it. More is not better. But the other interesting thing I did, and you had a very small capsulotomy. Your vision was excellent, but I told you, I said I would like to enlarge this capsulotomy, and you'll see better. And was I right?
Yes, absolutely.
Okay, I was right.
Absolutely.
That's
It
that's
was well worth doing.
yeah. But it wasn't your visual acuity. I mean, you were pretty sharp vision without glasses. It was the overall nighttime perception, the glare,
Correct.
whatever.
Yeah. It increased the brightness.
Yeah, yeah. And I've done this. I've done
nighttime.
this several times, and I'm surprised other ophthalmologists don't. They don't seem to recognize it or don't care. I don't know what the reason is, but I've done this, and I'm happy that we had a great result.
Very good.
Have a
Excellent.
safe trip.
All right, sir.